Hey everybody, I hope you had a great weekend. This week I have vascular disorders and the effect that they have on hearing loss. And I'm going to prepare you guys. I am still a little confused on the topic, even after researching it for a couple hours. But I will do my best to help explain it to you. Okay. So in our inner ear, we have a vasculature, which is responsible for three main things. It's responsible for maintaining the blood labyrinth barrier. It's responsible for transporting systematic hormones for ion homeostasis within the inner ear, and it's responsible for supplying nutrients for metabolic functions within our inner ear. It's really important that this vasculature stays protected, but it can be put into a critical state by autotoxic drugs. And it exposes our ears to critical blood vessels, and these blood vessels carry circulating inflammatory factors, immune cells, and hormones that affect the function of the ear. So these blood vessels can expose the inner ears to different infections that are most often protected from the inner ear vasculature barrier. And so with the vascular diseases being infecting the inner ear, that can have an effect on our hearing and cause hearing loss. So some signs and symptoms include fluctuating hearing loss, sudden hearing loss, or permanent hearing loss. And the most common hearing loss associated with this disorder is low frequency hearing loss. The patients might also experience sensitivity to their hearing. They might experience the sensation of ear fullness, the occlusion effect, tinnitus, and then some other disorders of the ear that are related to this are otosclerosis and otitis media. And this disorder, the vascular disorder, can kind of have or be the effect, like the lasting effect of otosclerosis, otitis media, with the ear being in a critical state from these primary disorders. Then the vascular inner ear disorder can be like a lasting effect from the damage that these disorders caused. Okay, so the etiology and the pathology. Okay, glycocalyx covers our capillaries, and it serves as a barrier to prevent circulating immune cells and large molecules from getting into the capillaries. With the barrier intact, no inflammatory factors can move into the tissue of the capillaries. But once the barrier is broken or stripped, then it is exposing the capillaries to different immune cells, different infections, and things that our ears aren't used to being exposed to, which can have an effect on the hearing. So the injury can cause a breaking down or the stripping of the barrier on the capillaries. Inflammation can also cause this. Inflammation would be an example of a lasting effect from something like otitis media, tympanic membrane perforation, any other primary ear disorder that would cause inflammation within the inner ear. And then the loss of the tight junction of the glycocalyx causes the ear to open the blood labyrinth barrier, which, like I said, exposes now our capillaries to the infections. And this causes a compromised endolymph production and the decreased endolymphatic potential, which we know the endolymph is the fluid within our inner ear that maintains our balance and everything. So, and then some other causes of inflammation within the cochlear vasculature can be noise, autotoxic drugs, like I mentioned before, or trauma. And then statistics. So there's not a lot. There really isn't much at all. And that's kind of what I was finding out with the vast majority of information surrounding this topic, is that there really isn't a lot of data out there and precise like studies on this. And so it's still kind of like being questioned, being researched and studied, the topic is. But what I was able to find is that vasculature disorders are believed to be a main cause for immune mediated hearing loss, Meniere's disease, and sudden hearing loss. And then the incidence of autoimmune diseases of the inner ear is 30 to 50%. And it's believed that vascular compromise in the ear is the etiology of those autoimmune diseases in the inner ear. And then I just found a few different groups of individuals who could potentially be more susceptible to this disorder. And that would be individuals who have diabetes, individuals who smoke, individuals who have hypertension, heart disease, and high blood pressure. And basically these patients are all more at risk for like cardiovascular disorders or diseases. And so it makes sense that their compromised immune system would also, or could also, make them more susceptible to vascular diseases in the inner ear. And then treatment and management. So I was really finding like the same answer on most of the articles I was reading. And that is that doctors recommend steroid treatments. I was researching how to diagnose this, and I really wasn't able to find like anything that made sense. And so I am assuming that the patient would be diagnosed with the vascular disease prior to, like, they would already have that diagnosis. And then once they went in to get their hearing tested and try to find the etiology of their hearing loss or their hearing difficulties, and try to diagnose that they would, with the patient's case history, the audiologist might be able to connect the two. And so then it really gets into treatment, how they kind of confirm the diagnosis, if the treatment options are helping. Basically, if they are working and helping the patient, then that kind of like confirms that, okay, their hearing loss was caused by vascular disease. But okay, so the main treatment option that audiologists use are steroid treatments, and specifically therapeutic glycocorticoids, such as dexamethasone and prednisone. These steroids suppress the production of inflammatory cells. So that's going to decrease inflammation within the ear, which is going to make the ear less susceptible to infection. They also cause apoptosis of existing cells that proliferated during inflammation. So basically any cell that was like formed during this inflammation that is carrying the infection, the steroid will be able to kind of like kill the cell off, the infectious cells off. These steroid treatments also suppress the production of inflammatory immune cells and the production of antibodies that fight against the infections. So they can also fight off against autoimmune, like the antibodies that are fighting autoimmune diseases. And then they can also stimulate the production of inhibitory factors that interrupt inflammatory cascades within the cells and trigger regulation of cell genes involved in production of proteins that release lining. And then here are my references. Again, I apologize. I am still pretty confused about this myself, and I read a bunch about it. I hope, at least hopefully, some of this made sense to you guys. I also wasn't able to find a video. I was really hoping that a video would be able to explain all of this a lot better than me, but unfortunately I couldn't find anything. So if you guys have any other resources that explain this better or make this easier to comprehend, please send them my way, because I am still confused. But okay, yeah, I hope you guys have a great week. Bye.